You're listening to Health Professional Radio. My name is Wayne Bucklar, and today my guest is Graham Howard. Graham's both the agency manager and the agency owner at Frontline Health, and he's talking to us from Brisbane. Graham, welcome to Health Professional Radio.
Thank you, Wayne. Nice to be invited on.
Now, Graham, Frontline Health is not a business title that immediately tells me what it is you do. Can you fill us in on what it is Frontline Health does, and can you give us an idea of where you do it?
Yeah, sure. Thanks for the opportunity. Frontline Health provides specialist permanent recruitment services, and we do this across all sectors of the health industry. As you would no doubt be aware, the health industry is a huge umbrella, and we do manage to work across the majority of sectors within that. So we work across industries such as the hospitals. We're big in aged care, medical centres, to also pharmaceutical and medical device companies, and everything in between. I guess our clients range from multi-site aged care organisations, large hospitals, to global multinational corporations. And keeping in mind within that, the positions that we do recruit for, they are many and varied, and I guess range from all operational and administrative levels, but we also look to recruit in the senior executive positions as well.
Right, so you go right across the spectrum.
Absolutely, yeah, it's a big beast, the health portfolio. You were asking, I think, Wayne, about where we do it.
Yeah.
We've got agencies in Brisbane, Melbourne, Sydney, Perth, Canberra, and New Zealand. So the great thing about our organisation is we're able to offer that national coverage, but with local expertise and local owner-operators on the ground in each state and territory and in New Zealand. When I say us, it's not a huge team, but there's about 16 specialist consultants in our team. The good thing, and I think the proud thing that we're about, across this team, we process more than 25,000 job applications each year.
Wow. We
interview more than 2,200 candidates. And last year, in 2015, we were really pleased to place over 300 healthcare professionals in a brand new role.
That's surprisingly large numbers. It is, as you say, a very big sector. Graham, is there a message that you'd like clinicians to take home today? As I usually tell people, we get about 95% of our audience are clinicians of some kind or another. What's the message for them?
Yeah, that's a really good question for us. So I guess it's important, Wayne, to clarify that as recruiters, we actually work with a lot of people across the businesses we help, from clinicians, operations people, clinical managers, senior management. And of course, because we are in recruitment, we also deal with those internal recruitment and HR teams as well. But because we specialise in permanent recruitment, we take on the entire recruitment process from end to end. So any of the clinicians, any of the management, they're looking to employ people, we're saving those people time and money, and more importantly, allowing the clinicians of the world to focus on what their core business is, which isn't recruitment per se. So when we work on an assignment, we try to take as much off their hands as possible. So we advertise the positions, we would process those applications, we do the screening, we interview candidates, and as many as possible we would interview them face-to-face, again going back to that national coverage that we have. We organise the interviews with the employers, we do reference checking, we negotiate the job offer, and a whole lot more in between. One of the things, Wayne, that we are particularly passionate about is that once we place someone into a role, we then follow up with both parties after a period of time to see how that person is settled in. Because, you know, when people go into a new role, it's great to think it's going to be ABC, not so good if it turns out to be X, Y, Z. So we touch base with both parties on a regular basis just to see how that fit is going. Recruitment, I guess this particularly to your question about clinicians, but if I can lump in the recruitment and HR teams in there as well, Wayne.
Mm-hmm.
What we at Frontline Health are trying to do is build long-term relationships with those clients and also the candidates. So we want to provide quality and consistency in what we do, and I guess, provide the client with exceptional candidates and provide our candidates with great new careers working in different fields.
If you've just joined us today on Health Professional Radio, my name is Wayne Bucklar and I'm in conversation with Graham Howard. Graham's the agency owner and manager at Frontline Health in Brisbane, and we've been talking about the recruitment work that Frontline Recruitment Group do, and we've been talking about the recruitment work that Frontline Health do, and we're just about to move on to my favourite question. Graham, in every industry, in every endeavour, there are always misconceptions. What's the misconception amongst your customers, clients, recruits, clinicians? What's the misconception that drives you nuts and keeps you awake at night?
Would I love to say that there are no misconceptions about what we do? It's always interesting because when you're on this side of the fence, you always think it's very clear what we do.
Yes.
But undoubtedly there are misconceptions. So it's actually a really good question and a great opportunity, I guess, to try and alleviate some of those. And I guess I'd look at it from two perspectives. One is from the candidate perspective and one from the client's perspective, the clinicians. If I could talk about the candidate perspective, first of all, there are a couple of misconceptions from their part. Firstly, the belief from them that we can place every person that comes to us. Mm-hmm. There are only a certain number of positions. There's lots of candidates. So unfortunate though it is, we're always going to be saying no to more people than we are going to be saying yes that get a role. But everyone that comes to us thinks they're going to get a role, and within a week. And that's the second part of a candidate's misconception. I guess the belief that the client is working to the same time frame that they are.
Yes.
So when a client is slow to get back to us, doesn't communicate effectively with us, then the candidate can and absolutely does get frustrated with the whole process. And again, if I can just touch on, Wayne, when clients are slow to work with a recruitment agency, not just us, any of them, it doesn't reflect well on their brand either, because the candidate is at the end of this, they're very eager to know something. So we always say in our business, yes is good, no is good, not knowing is the worst scenario for everyone concerned. Yes. From a client perspective, Wayne, no doubt our biggest frustration with clients and the misconception is they see all recruitment companies as the same, with little differentiation between them, which is simply not the case. There is much, much more to recruitment than sending across a CV. More than 65% of our placements last year in Frontline Health were in a job different from the one that the candidate actually originally applied to. Right. The end result, putting a higher caliber candidate in a new role, it's just not reflecting what the work involved in trying to achieve that outcome. So what I'm saying about 65%, they came into our system applying for a different role, but we placed them in a role somewhere else because we identified the skill set, built relationships with our clients, understood what they were looking for. So we're not just looking for that quick one-off placement. We're looking always to build strategic relationships with healthcare businesses, trying to give best choice to candidates and best candidates to our clients.
Well, Graham, with a little bit of luck today, we can help to dispel or at least ameliorate some of those misconceptions that you've talked about. Is there a way for people to get in touch with you, Graham?
Yeah, a couple of options. First of all, there's our website, so www.frontlinehealth.com.au. Alternatively, I'm happy to take emails from anyone that wants to email directly, and that's ghoward, all lowercase, GHOWARD @frontlinehealth.com.au.
Now, if you've just joined us and you've missed my conversation with Graham, the good news is there's also a transcript on our website, and on SoundCloud and YouTube, we have an audio archive where you can hear the full interview again. So that's at the Health Professional Radio website at www.hpr.fm. Graham Howard, agency owner and manager, at Frontline Health in Brisbane. Thank you for your time today. It's been a pleasure having you on the air with us.
Likewise, I appreciate the opportunity, Wayne. Good talking to you.
It's been our pleasure. You're listening to Health Professional Radio. Thank you for joining us today.